Hello and welcome everybody. And Katie, thank you so much for joining me again on one of our joint webinars today with Wellspring Healthcare and Ascend Hospice, talking about communication. And communication is one of those things that is so often, I think, overlooked as just an expectation of we're going to do that well. And so I think it's so important to reiterate this from not only a clinician perspective, but also from a patient and family perspective as well too. So I'm really excited to have you join. Let's go ahead and bring up our presentation here. And so we have communicating with patients and families. And one of the things that I just liked about this is, I always pick these images off of Adobe stock, right? And so I really look through to try and curate the right image. And I think that this image in particular helps to convey a lot of different things. You have the clinician that is over here, and she's leaning in a little bit. She's interested. She's making eye contact. She's engaged. And then you have the family that's all paying attention to this one person. And you can tell that she's the speaker and everyone else is listening. And I liked that image because I really thought it helped to highlight a lot of good behaviors in general. So, all right, so moving forward here, let's go ahead and hit our disclaimer real quick. Of course, this presentation is intended for informational and educational purposes only. While I'm a licensed physician, I'm not acting in the capacity as a physician for this presentation, and you should not take this as medical advice, diagnosis, or any treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding medical conditions, and never disregard professional medical advice or delay in seeking it because it's something that you may have heard or seen in this presentation. And of course, no doctor-patient relationship is being established at this time. All right, let's go ahead and move on to our next slide. So a little bit about Wellspring Healthcare. We believe in the power of compassion, effective communication, and empowering education to really transform lives. It's the reason why we do these webinars, because we want people to get the right information, to hopefully have it be provided to you in a way that is easy to understand, to digest, and so that you can be the main driver and captain of your ship in regards to your underlying healthcare. So of course you can keep in touch with us. Please reach out to William. He is our medical assistant, 816-708-1661. Or if you're a facility that is interested in improving the communication between your physicians and your patients, please don't hesitate to reach out to Brandy. She can certainly help you as well. And of course, there's lots of great resources on our website. If you're someone that prefers to read your content more, we also have a great blog section as well. All right, and of course, we can't forget our friends over at Ascend Healthcare. So please reach out to them if you're someone that is a patient or a loved one that is struggling with someone that is in a terminal condition and needs some further assistance with hospice. I'm one of the medical directors with Ascend, and it is an absolutely phenomenal company that just strives to meet the needs of their patients where they are. And I think that's one of the greatest things. And it really blends well with the conversation that we're going to have today in regards to communication and conversation, and really helping to drive those factors forward for us. We've got our telephone number here of 816-584-8111. All right, so let's jump into it, Katie. So communicating with patients and families. Katie, before we even get started, what is one of the most challenging aspects to communication that you find dealing with hospice patients?
I think just the fact of hearing the word hospice sometimes puts people on a little bit of a defensive, and that immediately kind of sparks this fear of, oh, they're telling me something I don't want to hear. They're going to try to make me do something that I don't want to do, or giving up. I don't know if that's been your experience as well.
Oh, it's huge, Katie. No, sometimes the H word, hospice, is can almost be as inflammatory as the C word, cancer, right? And it's a lot of people have very heavily charged emotions about hospice. And I think in general, this goes for a lot of topics within healthcare, right? Hospice, cancer, a big surgery. There's a lot of apprehension because that patient is being told that something is wrong with them, or that there's a problem that we cannot cure, from a perspective of hospice, right? We can't fix that. But what we can do is we can meet you where you are, and we can really help to facilitate you living your best quality of life and having that conversation and discussing what that really means. So that's kind of what I wanted to hit with today in our conversation. Is I wanted to hit this from both sides, because sometimes I think it can be a little bit lopsided where it looks like we're speaking directly to the clinicians. And I think that we are to some degree, but at the same time, we need to be talking to families and patients as well too, so that they understand that we as clinicians, that we as providers are going to be trying to meet them where they are, so that they can be open to hearing what we need to tell them, I think is another big factor as well too. So I wanted to hit these three main topics, and I've already mentioned this a couple of times, meeting people where they are. And I think that's just so huge and so important. I also want to just briefly discuss emotional intelligence, because it's a huge topic, and we could have, multiple hour-long webinars speaking specifically on emotional intelligence. But I think that it's really valuable for everyone to rehear again, right? There's some of us have come across emotional intelligence at some point in our lives, but having a little reminder on what that is and how we can work on it, because it's a great skill. They say that your intellectual quotient, your IQ, is not something that you can often change or improve or things of that nature. You just have your emotion or your intellectual quotient. But your EQ, your emotional quotient, we can actually adapt and we can change and we can improve it. And it's been a wonderful journey from an EQ perspective, even for myself. I used to think that I was quite good at this. And then I took one of these surveys and my wife was like, Brian, you're not good at that, So it's always fun to have that wherewithal, that self-awareness to be able to reflect on it and then to move forward. And then, of course, I think you can't speak about communication without some level of conflict, because I think that going back to what we said before about with patients and having this terminal diagnosis, they're going to have very conflicting feelings. They're going to feel scared, and they even may lash out, or families may lash out because they are scared and they're angry and they're not maybe self-regulating their emotions very well, right? And so we as healthcare providers need to be able to accept that, to see where they're coming from, meeting them where they're at again, to be able to come back to that. So that's kind of our quick overview, but I wanted to jump in here to meeting people where they are or where they are at. And so I think empathy and understanding is huge on this. And so, Katie, one of the things that I think that I find when talking with people is that empathy, we have empathy for people, we care for people, but sometimes because this is our job and it's what we do every day, it can become very rote. And not that we're trying to become numb to things, we sometimes can be, or we've set up barriers to protect ourselves so that we don't go home in a crying, sobbing mess all day. So when you're dealing with this or struggling with this yourself, or talking with new clinicians, how do you help them to find that empathy and that understanding, and to make it a regular part of their day?
I think just taking a minute before you go in, sometimes before you start that conversation. And I find that when I'm going in with my agenda, like I've got to get this checked off, get this done, I have this coming up next, that's when my empathy lags the most, because it becomes me-centered as opposed to I'm here to serve, and I'm here to, what is my purpose to be here?
I love that, kid. That's really powerful, because I think you're so right. You said you came in with your agenda, right? And I think that it's so important, because you're right. We all have an agenda, right? We have certain things that we have to do. We have certain things that we need to check off. We have certain forms that they need to sign. And we also have a general perspective in where we want this conversation to go, or the types of things that we feel that are going to need to happen, right? So a family may call us and say, my father or my daughter or my husband or somebody, had a fall. And so we're going in with a preconceived set of notions saying, okay, they fell, I'm going to check blood pressure, I'm going to do this, I'm going to do this, I'm going to do this. And I think you're so right in terms of you're giving yourself that period of pause to first go in and be like, I'm so sorry you fell. Let's talk about that. How did you fall? Right? Giving that patient the opportunity to do it, and to make that little bit of space, because it doesn't take long. And that immediately, I think, allows that patient and their family member to calm down as well too, because they're going to be anxious that you're coming. They're anxious in regards to hearing what you have to say, or they are concerned. My wife always mentions to me, she says, doctors, and I think by relationship, doctors, nurses, people that are in healthcare, she says, you guys are intimidating. And I always question it. I'm like, why? I'm like, I don't feel like I'm an intimidating person. And she's like, you're intimidating because you have the answers. Yeah. I don't know what's going on, and you have the answer. And so I'm intimidated by that because I don't know what the answer is, and I want to know what it is. And so I think that that's something that I think about, and that's what I do in my 30-second pause before going into a room, is thinking, where is this patient coming from? So.
And part of that too, that space and tell me about this, I'm so sorry, this or that or whatever, it gives you a chance to hear, what do they think the problem is? We think we know what the problem is, and it may not be their problem, right?
Oh, so true. So true. I can't tell you how many times, and we get taught this in medical school and we forget it, right? But we are taught, give the patient a minimum of 30 seconds to 2 minutes to speak, and they will tell you the diagnosis as they talk to you. We are taught, but yet we let that go because, again, it gets into the rote aspect of it. One other thing I wanted to mention here, Katie, and you brought it up about how important it is because, respecting this patient, because you have your set of agenda, but the patient has their agenda. And I think, respecting their autonomy and their ability to make their own decisions and their agency, and bringing them into that fold so that they don't feel intimidated, so that they don't feel that they're just being spoken to or talked down to, that we're bringing them into the conversation, and we're having a discussion. I had a conversation with a nurse actually just 20 minutes before our phone call, and this poor patient is struggling. He's having some issues where he's having this what we call orthostatic hypotension. So his blood vessels don't support enough fluid, and so he tries to stand up, and he gets dizzy, weak, tired, and lethargic. And the problem, though, is that if we take away his diuretics, then his belly fills up with fluid. Yeah. Well, we're going to catch 22. And so I think that that's the type of situation that this type of communication is so important and so valuable, because we have to have this conversation with the patient to say, I respect your autonomy. I respect your agency. And these are the two problems that we're dealing with. And we have to kind of pick the lesser of the two evils in this situation, because it's almost impossible to manage both of them effectively. So how are we going to work through that? And I need your input on it in order to help me make the best choice in regards to your medications or things of that nature. So I just think it's so important to try and respect that autonomy and that agency.
The other, I agree. And I think the other thing I would add to that is the idea of, respecting someone's autonomy. There's a certain group of people that I promise they will not let you disrespect it. And what I find myself is, when I've really struggled with a family, with a patient, with whatever, sometimes I realize I'm going, oh, they're telling me they're not having any of this. And it's like, duh, it's like, and they may not be real upfront with it either. It might be kind of a backdoor, kind of, I'm not going to do what you're suggesting, or I'm not following through on certain things. And when it comes right down to it, they're doing it their way.
Absolutely. Well, Katie, that was the perfect segue as well too, because I think that brings us into one of our emotional intelligence aspects, right? So it's having that conscious ability to understand where you are, but then also, and in our next slide, we're going to talk about social awareness, right? But first, before we can have social awareness, we have to have self-awareness. And you were actually very keen on that because you were understanding of that. But this is what we talked about in the first slide, where when we are walking into that room, or we're walking into that home, or we're walking into that post-acute care building, we as the clinician and the provider has to be aware of our own emotions. And we have to try and help regulate those emotions, be aware of those triggers, aware of those strengths, and give ourselves that moment to pause, right? Like maybe we just came from something that was horribly, horribly stressful, right? We just had a death that we had to deal with maybe. And now we have this opportunity where we have to pause because we have to reset and go in. And so being self-aware. And I think that this is also very important for families and for patients as well too, to be self-aware and to understand that I'm going to be highly triggered by certain things and by the conversations that we're going to have, and that I'm going to give myself the permission as a patient or as a family member to say, wait, pause, pump the brakes. I'm not understanding, or I need you to explain that to me in a different way because I'm not understanding it, or I'm being triggered, or I'm being frustrated by the way you're communicating with me. Let's take that moment to pause. I think it's really important.
Sometimes we have to put the brakes on for them. There are situations where we're working with folks whose EQ is extremely low. Their coping skills are not there on a best day. And that's just part of working with the general population, you know? And so I always tell my social workers, my chaplains that I supervise, I'm like, it's okay to say, hey, I'm going to give you a minute. I'll come back to you later. When they're yelling, if they're cursing, they're really going off. That's not going to be a good positive outcome with that, you know? So sometimes it is our role to act as that and say, I'm going to give you a minute.
Absolutely. That's again, having that self-awareness and that social awareness that we can have. And so I really think social awareness is kind of the crux of empathy, is being able to appreciate someone as a human being on both sides of the aisle, right? So clinicians needing to appreciate the patient and families as human beings, but then also the patient and their family understanding that we have a hard job too, you know? And not to say that our situation is in any way comparable, but at the same time, we both are in a different position. We have to be respectful of one another, and that we have this shared, you know, quality of life as human beings, and that we're here to try and help one another. So I think it's really important though to make sure that we reiterate that socially aware individuals are attuned to the feelings and needs of those around them. So like you just mentioned, Katie, if I walk into a situation and tempers are running hot, we're scared, we're nervous, things aren't going well, we need to, as clinicians, like you said, pump the brakes, say, hold on, I think we're getting a little derailed here. This isn't what I'm wanting to do. Let's come back in a little bit, or let me revisit this tomorrow with you. Let's both sleep on this for a minute. We need to give ourselves some time here. And that sometimes I think that's perceived as a failure of communication. And I think that is exactly the opposite. I don't think it's a failure of communication at all. I think it's actually one of the highest levels of communication, in the sense of saying, we're not going to make anything moving forward in this regard. So let's pause. Let's allow the relationship to continue and reevaluate tomorrow. And I think usually level our heads prevail in those situations. But again, it's not going down that unfortunately, that sometimes that downward spiral can get going really quick. And we have to have that emotional and social awareness to be able to say, wait, pause, pump the brakes here.
Yeah.
All right. Last one on this one is, of course, empathy. So if we don't have social awareness, it's almost impossible to really have any sort of empathy. But empathy is different than sympathy. It goes beyond that by thinking of yourself in that person's shoes and experiencing their emotions from their perspective. And I think that if you really take that time before you ever go into the room to put yourself into that patient's shoes, it makes it a lot easier to be understanding and to be able to carry on that conversation.
Yeah.
So, yeah, definitely. Katie, what do you think in regards to, because I have down here the development of trust, rapport, and collaboration. Can you think of a situation in which you're able to proceed with trust, collaboration, if there's not shared empathy?
No, I don't think so. And I think that, I think that, when we're talking about clinicians and professionals, you kind of have one or the other. You have somebody that oozes empathy to the point where they really do need to tone it down, to the point where they're taking on pain or things that is not their own, right? And then you have it on the other end where you're like, okay, I'm kind of numb to it, maybe you're a little bit more cerebral. And so how do you hit that balance? And I think that hitting that balance is the key to that trust and rapport and collaboration, because you can't help somebody if you're drowning in the same, sadness and
Sure.
grief and whatever. And you also can't help them if you're clear up here and not even seeing what they're struggling with, so you've got to hit it in the middle.
Absolutely, Katie. I think that's so great too, because it requires someone to be open to self-reflection and their self-awareness to be able to say, maybe I do this really well, or maybe I don't do this really well, or to be open to talking to other people to say, hey, how do you think that conversation went?
Sure.
How do you think I did that? And then really meaning, like, I want you to give me that feedback, and I'm open to hearing that hard conversation of, Dr. Haas, maybe you could have done this a little bit better. And I'm open to hearing that feedback, because I always want to improve, and we're all human, and we're all working to do the best that we can do on a daily basis. So we need that feedback. So definitely. All right. So again, we are always going to have some aspect of conflict in our jobs. And conflict can occur from a number of different sources. Sometimes, like this picture is kind of illustrating, right? It maybe is between family members, right? Or maybe it's between the patient and their caregivers, right? Or maybe it's between the family and the caregivers. And so what I find more than anything, Katie, is, where do you feel the source of conflict usually comes from?
Oh gosh, that's a really good question. I think it often comes from misaligned expectations.
I love that. Yeah, no, misaligned expectations. I think the other thing, we've mentioned this already before, but I think it's fear too, right? Again, it's a misunderstanding. It's I didn't know this was going to happen. But certainly it's that expectation. It's why Disneyland, right? You walk into Disneyland or Disney World, and they tell you that the ride is going to take 65 minutes to get from where you are to where they are. And they always get you there earlier because they want your expectation to be good. They don't want to tell you 65 minutes and you be there an hour and a half, because then you're going to be upset. You're like, you told me it was going to be this. So I think that you're so right. The expectations are really beneficial to that. So understanding the source of conflict can often be important, but how do we deal with conflict, I think is very powerful, right? So whether or not someone is going to, how they come into that situation. So if someone's already upset because they had a misaligned expectations, how are they going to best be able to handle that conflict or diffuse that conflict? What are some things that you talk to people about, Katie, when you're in it, or you're dealing with conflict yourself?
Really try to look for the commonality. Okay, where can we agree?
Yeah.
Sometimes it's super simple, and it's usually fair to say, I think we all agree that, we want your mom, your whatever, to be comfortable or stay in the facility, or, do as well as you can, feel as good as you can. I think also the idea of giving them their due as far as what they do know. It's like you mentioned, the intimidation. As as a clinician, as somebody that as a professional helper, we need to acknowledge what they do bring to the table, and it is a lot. Like oftentimes these families, they know a lot about their family member, and we have to remember, we know a lot too, but we know this little snapshot of them in our office or from the time they've lived in our facility, where the family has a much broader view. And so just acknowledging that, I think, goes a long way.
Oh, I love that, Katie. I love that. And I think by acknowledging too, I love the way that you phrase that too, because acknowledging means that you've listened. You have actively listened, like the very first picture at the beginning of our slideshow, right? It showed that person leaning in, listening actively. And then knowing, I think what you just very clearly articulated, knowing when to try and quote unquote fix the problem, or just finding that shared commonality. It's something that I struggle with a lot. I think a lot of men in general, I'm speaking on behalf of men here, which is a broad generalization and probably not something that is usually the best idea. But a lot of the times men always want to fix the problem. And something that I have certainly learned throughout my life is that I don't necessarily always need to fix the problem, that maybe I just needed to simply be the person that sat there and listened. right? Because maybe that expectation was malaligned. I can sit there, I can listen to that person, and they feel a lot better after they've had that opportunity to be listened to. And so I think that's really important. I think the other thing that's really valuable in that situation, of course, is having some aspect of interdisciplinary collaboration, right? And you've mentioned it already in the sense of taking that opportunity to step back, to pause, to say, let's revisit this, right? And then in that regard, you can also see, you know what, I hear that we're not having the greatest conversation here, or this isn't going the right way, or we're getting further apart rather than coming closer together. And so I want to pause here, and I want to bring another member of my team in that might be able to help better explain this. Maybe I want to bring in that social worker if you're a nurse, or maybe if you're the social worker and you don't have the same clinical level of expertise as the nurse does or the physician does, you want to bring that person in. And so working in that interdisciplinary team can really be valuable in order to get everyone on the table. Or maybe you're having the difficult time with, you know, a family member. Maybe we need to bring in the patient, right? If the patient is capable of having that conversation. Sometimes they're not, of course, if they're have severe dementia, but sometimes that's really valuable to bring them into that or have them be part of that conversation.
Yeah,
so,
absolutely.
Perfect.
Yeah.
Perfect. Well, great. Well, Katie, that kind of covers us from a wide overview of communication. But I am really excited. We're going to have next month, we're going to have another webinar where we're going to talk about integrative and holistic approaches to end-of-life care. And so that's a little bit kind of out there, but this is going to be more of like our pastoral services. This is going to be like our massage therapy, which I think a lot of people don't realize that we have massage therapy as part of hospice. And then, of course, or music therapy as well. So you can be really beneficial as a holistic approach to end-of-life care. So really looking
They're
forward
way more
to that.
popular than us. I mean, you can't compete with that, can you?
Yeah. No, seriously, like the doctor comes in and says, I want to listen to your heart and lungs. And then someone else comes out, I'm going to sing you a song. I'd much rather visit with the person singing me a song.
Me too.
Absolutely.
Well, thank
All
you so
right.
much.
You're so welcome, Katie. Well, let's make sure that we have everyone knows who to get in touch with here at Ascend Health. You can reach out to Christina Cole. Her email is christina.cole@ascendhealth.com, or reach out to us at 816-584-8111. And then, of course, if you'd like to reach out to William with Wellspring Healthcare, 816-708-1661, or visit us on our website at www.wellspringhealthcare.org. All right. Well, thank you again, Katie. I really appreciate the opportunity that you spent with us today. And I hope people got a lot of content and value from it. Thank you.
Take care.
You too. Bye-bye.